Hi, my dear pathology buddies. Very nice to see you all again through this video. Good morning, good afternoon, or good evening, as usual, depending upon the time you are seeing this video. This time I thought I will just go through the basic points in the GIT lesion, how to approach. Predominantly, it covers GIT biopsies. Again, it's more morphology based. I may not be talking much of molecular. Before going into the exact GIT approach, I want to know who is your boss. You answer by yourself. And I think this I asked even in my previous video. So you are your boss, yourself. This is the answer I want to hear from everybody. This is very essential to have a very high self-esteem. And if you know that you are your boss, life will become very happy. The next question, who is our boss? You are your boss, but who is our boss? Our boss means people like you and me and people who are involved in the healthcare delivery. The patient is our boss. That understanding also very, very essential. So the patient meets the clinicians first. They come with complaints and tell the same thing to the clinicians. The clinicians do a physical examination after getting their thorough clinical history. They write lab and radiological investigations. They have their own provisional diagnosis. Since we are dealing with the GIT in this presentation, probably they may go for endoscopy and biopsy. The radiologists give a radiological diagnosis, and the pathologist, we after getting the biopsy, we give a pathologic diagnosis. So the end point is the patient is having three diagnoses now: clinical, radiological, and pathological diagnosis. It has to be correlated to come to a final diagnosis. All the clinical, radiological, and the pathological findings should be focused into a final diagnosis. And then treatment should start on the final diagnosis. And the patient has to respond to the treatment. This is the most important thing. If the patient is not responding to treatment, then whatever we do, it's not going to serve the purpose. Only when the patient responds to treatment, the patient will become happy. And when the patients are happy, all the three people involved, clinicians, radiologists, and the pathologists, can be happy. This is very necessary to understand the psychology of a medical care team. Our boss is patient, and patient should be happy by the way of responding to the treatment. Then only our diagnosis is correct. You may give a correct diagnosis, clinical, radiological, pathological, all of them may give a diagnosis, but if there is no response to the treatment for that diagnosis, again it is not serving the purpose. So the bottom line is, we are our own boss, our patient is our collective boss, and we have to keep a happy patient by the response to treatment. Specimen, this is what we get in the lab, and you have to remember, behind each specimen there is a patient. This is very, very essential. And as a pathologist, from the time of training, you have to remember the difficulties in getting this specimen. What we do in our hospital, we do 2 days posting for all the first year PGs in all procedural areas. For example, in endoscopy, colposcopy, bronchoscopy, every procedural area we post them for 2 days. In these 2 days of posting, they will know and they will see by their eyes the difficulties the patient is undergoing in the way of getting the specimen. So this personal experience is very, very essential. Another thing you have to remember, it is our privilege to serve the patient. Healthcare is the only profession where we deal with sick people, and we have to take it as a privilege. And our patients deserve more. That is another essential thing. We have to serve our patient in always a better way. I will give you some beautiful references, and then we will go to introduction, where we remember all the concepts. This knowing the concepts is very, very essential before interpreting the biopsies. Then we will go organ by organ. We will go from esophagus, move on to stomach, then into small intestine. Appendicular lesions we will be seeing. After that, large intestine and anal canal. So we will be covering each organ of the GI tract after knowing the basic concepts of how to interpret a lesion. Then, as usual, we will end it with a conclusion.